Oxidative stress from free radicals is one of the pathways implicated in the development and deterioration of Alzheimer's brains.
This is Dr. Michael Herschel Greger, an American physician, New York Times best-selling author, and advocate of plant-based diets. Being a licensed practitioner, Dr. Greger has published several scientific reports in the American Journal of Preventive Medicine, Critical Reviews in Microbiology, Family and Community Health, and the International Journal of Food Safety, Nutrition, and Public Health. Regarding mental health, Dr. Michael Greger has always stressed the need for plant-based diets and natural supplements. He has come forward with a variety of naturally available minerals and vitamins for healthy cognitive function. In this video, we will explore 4 supplements shared by Dr. Michael Greger to prevent Alzheimer's disease and dementia. Besides preventing cognitive diseases, one of these supplements will also help with the symptoms of depression. Beyond that, we will also look at some lifestyle changes recommended by Dr. Greger that could prevent Alzheimer's disease. So watch this video until the end to acquire the maximum benefit. But before we dive deep into 4 supplements suggested by Dr. Greger, let's talk about the causes of Alzheimer's disease and dementia. Alzheimer's disease is generally the common cause of dementia. The onset of dementia disease before the symptoms come into play triggers the accumulation of protein and fiber tangles, which cause the nerve cells in the brain to die. The symptoms begin with memory loss, and eventually, the damage expands to other areas of the brain, impacting cognitive and behavioral functions alongside other body issues.
Alzheimer's patients have significantly lower blood levels of 8 out of 10 antioxidants investigated, though of course this could just be a consequence of demented individuals eating diets poor in fruits and vegetables.
At the time, there isn't a cure for Alzheimer's disease. However, many scientists have researched nutrients and their capability to fight or prevent Alzheimer's disease. While there are contradictory views on whether a supplement will work, Dr. Greger's list of 4 supplements shared in this video is evidence-based. Let's check them out. The first supplement on our list is Beta-Carotene. Beta-Carotene is a pigment and an antioxidant found in plants. It provides yellow and orange fruits and vegetables with their rich colors. As an oxidant, Beta-Carotene helps protect the body against harmful molecules called free radicals. These free radicals attack and destroy the body's cells in a process called oxidation. With time, the damage further escalates and results in more severe health conditions. Evidence-based studies show that consuming antioxidants can make your immune system stronger, fight against free radicals, and prevent other chronic mental diseases. But beta-carotene has the added advantage of being a pro-vitamin A as well. Its metabolites function as nuclear receptor ligands, helping with the regulation of several metabolic pathways, which include inflammation, lipidation, blood-brain barrier integrity, and synaptic plasticity. Concerning its relation with brain functions, beta-carotene may also have cognitive benefits. Many research studies suggest that beta-carotene metabolites boost cognitive benefits and therefore may have a protective role against Alzheimer's disease.
In the Harvard Physicians Health study, nearly 6,000 older men were randomized to beta-carotene or placebo. No difference was found after 3 years, but after 11 years, those unknowingly taking the equivalent of a 3/4 cup of sweet potato worth of beta-carotene a day had slightly yet significantly better overall cognitive performance.
During a Harvard Physicians Health study, around 6,000 older men were used as participants who were given either beta-carotene or a placebo. No changes were witnessed in 3 years. However, after 11 years, it was discovered that participants who had consumed 3/4 cup or 150 grams of sweet potatoes rich in beta-carotene appeared to have better cognitive performance. Beta-carotene is naturally found in yellow, orange, and green leafy fruits and vegetables like spinach, carrots, tomatoes, lettuce, sweet potatoes, winter squash, broccoli, and cantaloupe. It is believed that the brighter the color of the vegetable or fruit is, the more beta-carotene one can expect in it. Besides, beta-carotene is also available in gel form or capsules. It is fat-soluble, so it is suggested to have it with meals having fats to ensure the absorption. However, to stay on the safe side, it is better to rely on a healthy diet full of fruits and vegetables. Having 5 or more servings of fruits and vegetables can ensure 3 to 6 grams of beta-carotene. If someone is diagnosed with erythropoietic protoporphyria, consultation with the doctor is necessary to determine the correct dosage. The next on our supplement list is vitamin C. Vitamin C is a water-soluble vitamin that helps in general growth and development. In contrast to fat-soluble vitamins, water-soluble ones easily dissolve in water, and the remaining amounts pass out through urine. While the human body is capable of stocking a small amount of these vitamins, it is vital to consume them daily to overcome deficiencies. Vitamin C is also known as ascorbic acid, which has a key role in the neutralization of reactive oxygen species and reusing essential cellular antioxidants. In addition to that, ascorbic acid also acts as a cofactor in several enzymatic reactions necessary for collagen, L-carnitine, and many neurotransmitter synthesis, and in the regulation of gene expression. As for Alzheimer's disease, oxidative stress is found to be the cause of many neurodegenerative diseases, including Alzheimer's. To combat oxidative stress, it might be significant to ensure the intake of antioxidants like vitamin C, aiding in the prevention and progression of Alzheimer's disease.
Vitamin E and C were also tested. Vitamin E similarly flopped throughout, and so did vitamin C up until the last cognitive assessment at around year 9, where the vitamin C group appeared to pull ahead.
According to research, correct vitamin C levels in animal models with Alzheimer's disease might help slow down the formation of amyloid plaques, which are the main aspects of the disease. Moreover, higher plasma concentrations of vitamin C support healthy cognitive function and lower the chances of cognitive decline. Taking everything into account, there is significant evidence that having the right amount of vitamin C in a body can help with age-related cognitive decline and prevent Alzheimer's disease. However, it is better to avoid vitamin C deficiency than to have added amounts of it after a healthy and complete diet. The human body isn't capable of producing any vitamin C. The only way one can ensure the daily intake of vitamin C is by incorporating vitamin C-rich foods into their diet. A great deal of fruits and vegetables contain adequate amounts of vitamin C. Some fruits are citrus fruits: mango, papaya, cantaloupe, kiwi, pineapple, blueberries, raspberries, strawberries, watermelon, and cranberries. Vegetables include green and red peppers, broccoli, cauliflower, spinach, cabbage, sweet and white potatoes, leafy greens, turnip greens, winter squash, and tomatoes. Apart from fruits and vegetables, some other foods and beverages have added vitamin C. However, before purchasing these items, it is vital to check the product labels to find out the vitamin C content in these foods. The information provided here is for general informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a licensed healthcare provider before implementing any dietary changes or introducing new supplements. The third natural supplement is turmeric. Turmeric is a golden orange spice used in foods for flavor and color. However, its functions aren't limited to only flavoring and coloring. Turmeric has added nutrients that could help our bodies in certain ways. Turmeric contains a natural compound called curcumin, which carries both antioxidant and anti-inflammatory properties. Besides, it is packed with phytonutrients that actively neutralize free radicals and safeguard the cells from damage. As for Alzheimer's disease, many anti-inflammatory medicines are surfacing that could lower the risk of this disease, but their long-term use can harm the liver, stomach, and kidneys. Turmeric as a natural alternative might be a better choice to perform the same function.
In rural Pennsylvania, the incidence rate of Alzheimer's disease among seniors is 19. 19 people in 1,000 over age 65 develop Alzheimer's every year in rural Pennsylvania. In rural India, using the same diagnostic criteria, that same rate is 3, confirming they have among the lowest reported Alzheimer's rates in the world. Although there isn't much to go on, the lower prevalence of Alzheimer's in India is generally attributed to the turmeric consumption as part of curry.
According to research, curcumin has a key role in the prevention and treatment of Alzheimer's disease. It was found that its lipophilic action boosted the cognitive function in Alzheimer's patients. Many studies show that free radicals, oxidative stress, beta amyloid, cerebral deregulation triggered by biometal toxicity, and abnormal inflammatory reactions are the main causes of the onset of Alzheimer's disease. Curcumin, as an anti-inflammatory agent, reduced beta-amyloid plaques, slowed down neuron degradation, and decreased microglia formation. It also improved the memory of Alzheimer's patients. Additionally, one more study involving 1,000 participants showed that individuals who occasionally consumed curry with turmeric turned out better at cognitive performance than individuals who didn't.
1,000 people tested, and those who consumed curry, at least occasionally, did do better on simple cognitive tests than those that didn't. Those that ate curry often had only about half the odds of showing cognitive impairment after adjusting for a wide variety of potential confounding factors. This suggests that curry consumption may be associated with better cognitive performance.
Taking turmeric in supplement form is not recommended because it can lead to kidney stones, specifically if this condition is hereditary. Turmeric supplements have a strong concentration of spice compared to what is available in foods. The best way to meet the daily requirements of turmeric is through turmeric-infused meals. Incorporating black pepper with turmeric can add to its benefits, especially in terms of absorption. If you want to know more about the benefits of turmeric, make sure to subscribe to our QuickTime newsletter via the link below. Each week, we provide expert-backed advice, tasty recipes, and practical tips to help you live a longer, healthier life, delivered directly to your inbox. The last supplement on this list is vitamin B12 or cobalamin. Vitamin B12 has many functions in the human body, including the maintenance of DNA and red blood cells. Furthermore, it helps in the development of the nervous system, like the brain and spinal cord. Similar to vitamin C, vitamin B12 is water-soluble, and its excess amount is generally released through the urine. Although the liver stores vitamin B12, a deficiency can still develop if the necessary intake is not maintained. Vitamin B12 deficiency is largely linked with cognitive issues like thinking, learning, and judgment, as well as memory problems that might give rise to Alzheimer's disease. The signs related to Alzheimer's disease and other dementia types can be quite similar to those of vitamin B12 deficiency. Some symptoms like memory loss, enhanced agitation, and behavior changes might appear to be connected with Alzheimer's, but they can also signal low levels of vitamin B12. Many research studies have been conducted to determine the connection between the symptoms of Alzheimer's and vitamin B12 deficiency. Some studies showed the association of vitamin B12 deficiency with Alzheimer's disease and even the shrinkage of the brain. This proves that an inadequate amount of vitamin B12 could possibly cause Alzheimer's disease. A study suggested that vitamin B12 might have a protective function against Alzheimer's disease. During this research, the researchers gathered the blood samples of 271 Finnish people aged between 65 and 79, with no possible onset of dementia in the beginning. Within that time, around 17 participants ended up developing Alzheimer's disease. The blood samples went through the test for homocysteine, an amino acid related to vitamin B12, as well as for the level of activeness of holotranscobalamin.
Dating back to 1933, whose brains had turned to mush. They both suffered from extremely rare genetic mutations that led to abnormally high levels of homocysteine in their bodies. So is it possible, he asked, that homocysteine could cause brain damage even in people without genetic defects? Well, now here we are in the 21st century, and homocysteine is considered a strong independent risk factor for the development of dementia and Alzheimer's disease.
Enhanced amounts of homocysteine may negatively impact the brain and cause conditions like stroke. However, the higher levels of vitamin B12 can suppress the amount of homocysteine. The results of the study discovered that every micromolar increase in the concentration of homocysteine increased the likelihood of Alzheimer's disease by 16%, while every picomolar increase in the amount of vitamin B12 lowered the risk by 2%. None of the factors like age, blood pressure, smoking status, education, gender, and body mass index appeared to tamper with the results. Additionally, Folate supplements also proved unsuccessful in lowering the risk of Alzheimer's disease.
But the studies were tracking neuropsychological assessments, which are more subjective, compared to structural neuroimaging, actually seeing what's happening to the brain. And a double-blind, randomized, controlled trial found that homocysteine lowering by B vitamins can slow the rate of accelerated brain atrophy in people with mild cognitive impairment. As we age, our brain slowly atrophies, but the shrinking is much accelerated in patients suffering from Alzheimer's disease.
Vitamin B12 is available in a variety of foods, including dairy products like eggs, milk, and cheese. Other vitamin B12 sources are fortified foods like fortified breakfast cereals, nutritional yeast, yeast spreads, and shiitake mushrooms. Try including yogurt in breakfast, milk in lunch in the afternoon, and cheese slices as snacks. In the case of supplements, it is advised to consult with a health practitioner first to avoid overdosing and getting side effects. These were the 4 natural supplements that could potentially help in the prevention of Alzheimer's disease and dementia. But Dr. Michael Greger has also revealed some lifestyle changes that may prevent the disease. Here's what he says.
Mind attack, like heart attacks or strokes, needs to be prevented by controlling vascular risk factors, like high blood pressure and cholesterol, controlling that chronic brain hypoperfusion, the lack of adequate blood flow to the brain over the years before the onset of Alzheimer's disease, which means a healthy diet, physical exercise, and mental exercise. Here's the potential number of Alzheimer's cases that could be prevented every year in the United States if we could just reduce diabetes rates 10% or 25%. Because diabetes is a risk factor for Alzheimer's.
That is it. If you are interested in learning more about healthy lifestyle changes, check out this upcoming video.